we will discuss about fibrocystic change of the breast. Now, breast diseases can be classified into benign, okay, firstly inflammatory, benign and malignant. Okay, in benign also we have further two categories. This I am just talking briefly. So in benign also we have two categories. One is the non-proliferative diseases and other are the proliferative diseases. Now fibrocystic disease is used for this category, is the non-proliferative category of the benign breast diseases. So why it is important to classify the such classification? Because certain categories they pose risk of increased in breast cancer. So fibrocystic disease, till the time it's non-proliferative, okay, and is not associated with any atypia, it is not associated with any increase in the breast carcinoma. Now this is a disease which is seen in the reproductive age group. Okay, it is seen in the reproductive age group, that is the age from 25 to 45 years in a female, and it is a very common phenomenon because it is not a single entity, it is a collection of many things. So what are the clinical features? How the patient will present? Now patient will present with breast pain. Now this breast pain will be cyclical, that means it will alter with the menstrual cycle, and then there can be tenderness of the breast, lumpiness present. Okay, so a term is used for the fibrocystic disease of the breast. The on palpation, how does it feel like? It is lumpy, bumpy breast. Okay, so there is not a very clear lump, but there is a irregular lump present which is free to move, it is not fixed, and this term is known as lumpy bumpy breast. So it can be associated with polycystic ovarian syndrome, because now cystic disease is also estrogen dependent. So the condition where estrogen level is high, it will be associated, and usually you should remember that this is bilateral. Now going to the here you can see what happens is the normal breast tissue. Okay, and here you can see cysts are present, okay, in the breast. Going to the morphology. Now morphology depends upon various things. There can be multiple things microscopically which you can see in the breast. So first is the presence of cysts. Now if you see gross specimen, okay, if you cut it open, you can see multiple cysts are there. Okay, but we do not receive specimens, mastectomy specimens as such for fibrocystic disease, because it does not have any malignant potential, and this condition automatically, when the woman grows in age, especially when the woman goes into postmenopausal age, this condition will resolve on its own only. So therefore mastectomies specimen are not received for this. Morphologically on if you see microscopically, if you receive breast biopsy specimen, okay, there's a lump present and breast biopsy is done. So where at findings which can we see are, one is cyst, presence of cysts. So you can see these are the cysts present. Okay, now cyst in this fibrocystic disease, they contain a semi-translucent fluid which is brown in color, and this is the straw colored fluid. It's a brown colored fluid which is present, and especially when the size of the cyst increases, you see it from the surrounding tissue, it appears slightly blue in color. Therefore blue dome cyst word is also used. This is the appearance of the cyst. And how does it look like? It is dilated and it is lined by either flattened lining epithelium or apocrine cells are present. So this is the cyst part of the fibrocystic disease. Now what will happen when there are multiple cysts? Okay, so one of the cysts can rupture. When the cysts rupture, they will incite a inflammatory response to it. Okay, inflammatory response will be there, and you know, whenever there is inflammatory response and it is chronic inflammation is going on, it will lead to fibrosis. Okay, so fibrosis will also be seen. So the cyst rupture, they release the secretory material into the stroma. This will lead to chronic inflammation and fibrosis, and this fibrosis will lead to the palpable firmness. The lumpy bumpy breast will be because of the fibrosis. Other features microscopically which you can see is adenosis. Now adenosis, if you see here, is the increase in the number of acini per lobule. That means the number of glands are increasing. Okay, if there are increased number of glands you see, this is known as adenosis. Okay, so this is seen in you can see it in fibrocystic disease. It is a spectrum of disease. Not all things are present, and sometimes a variety of things are present in a mismatch fashion. Then you can see apocrine metaplasia. That means that the cells of the glands, okay, these glands, if you see the cells, you see they are very eosinophilic. Okay, these are very eosinophilic, and they have abundant cytoplasm. This is known as apocrine change. That can also be seen. Then epitheliosis can be seen. That means the cells, they show hyperplasia. The epithelium, they show hyperplasia. Okay, this is epitheliosis. And also because there is chronic inflammation, fibrosis going on, microcalcifications can also be seen. So this was a very short topic on fibrocystic disease. Do like, share and subscribe to this channel. Thank you for watching this video. Thank you.